Ladies and gentlemen, please welcome Grantmakers in Health Vice President for Program and Strategy, Osula Rushing.
Good afternoon. Welcome to the third day of GIH's annual conference on health philanthropy, Building a Just and Equitable Future. Many of you joined us on Tuesday and Wednesday, and it's great to have you back. For those of you who weren't able to log on yesterday, here's what you missed on Glee. GIH President and CEO Cara James and Chair of the Presidential COVID-19 Health Equity Task Force, Marcela Nunez-Smith, discussing how to center equity in pandemic response and recovery. Breakout sessions on the impact of the pandemic on children, catalyzing public health system transformation, and public trust and the COVID-19 vaccines. Networking sessions, one on substance use and drug overdoses, and one on creating communities that improve health for people of all ages. And Mona Hanna-Attisha, Tony Iton, and Laura Gerald discussing how to reprioritize public health. Folks are using the chat box to ask questions, make comments, and share resources, and using the hashtag GIHAC on social media to keep the conversation going. We're also getting great feedback on the quick takes, which are short TED-style talks available on demand. And if you did miss anything, recordings of the plenary sessions will be posted on the GIH website the week of June 21st, and resources from the breakout and networking sessions are posted under the Files tab of individual sessions. And now for today's agenda. We have another powerhouse day planned for you. We'll begin with a plenary session, which I'll introduce in a moment, and then head into breakout sessions, which will start at 2 o'clock Eastern Time. We'll have a 15-minute break for you to spend as you wish, and then we'll reconvene for funder-only networking sessions at 3 and our final plenary of the day at 3:45 Eastern. And for those of you who are eager to connect with your colleagues across the country, we'll have a social hour at 5 o'clock Eastern. And now, I'm delighted to open our first plenary of the day, Climate Change, Health, and Equity. Support for this session was provided by the Kresge Foundation. Our esteemed speaker will be introduced by Emily Yu, who is the Executive Director of the Build Health Challenge at the de Beaumont Foundation and is a member of GIH's Board of Directors. Emily, I'll turn things over to you.
Thank you so much. It's a pleasure to be here. And again, my name is Emily Yu, and I'm here to introduce our esteemed plenary speaker. I found a lot in common with her background and her just years of experience in climate change and climate justice. Our work at de Beaumont Foundation and with the Build Health Challenge really strive to work with communities to focus on advancing policies and practices that advance health and health equity. So our esteemed plenary speaker today, Elizabeth Yeampierre, is really one of our generation's leading environmental and climate justice leaders. Ms. Yeampierre is Executive Director of UPROSE, a grassroots organization that promotes sustainability and resiliency through community organizing, education, leadership development, and cultural and artistic expression. She's a longtime advocate and trailblazer who is working to address climate change, a sought-after speaker and award winner, and she's been called one of our world's most effective climate warriors. Ms. Yeampierre is nothing short of a visionary paving the way to climate justice, and it's my honor to introduce her. Please join me in welcoming Elizabeth Yeampierre.
Ashe, buenos dias, and thank you so much for that amazing introduction. It's always hard to live up to the kind words that are shared right before I begin to talk. Thank you so much for the opportunity to talk about climate justice, health, and equity. It really is the issue of our day. A lot of what brought us to this conversation, to this work, to environmental justice, to climate justice, really comes from our own personal lived experience. The leaders in the front line of the climate justice movement come from communities that have been disparately impacted. We are the descendants of extraction, both our land and our labor, of colonialism, of enslavement, and are now dealing with the consequences of 500 years of that harm done to our people and done to our land. And it's manifesting as this thing called climate change. Climate change isn't something that just happened the other day. It literally started with that extraction. And the climate crisis is a health crisis. It's a racial justice crisis. It's the exacerbation of all the historical harm done to Black, Indigenous, people of color, and sustained over time. We know that climate change is violent, that it's unpredictable, that it is disruptive. Think Hurricanes Katrina, Andrew, Superstorm Sandy, and Hurricane Maria. I have not stopped thinking about the devastation of historical Black communities in New Orleans, or the death of so many of my people in Puerto Rico, where suicide among teens skyrocketed, and the bodies of the people with the highest asthma rates in the world were piled up in people's backyards during Hurricane Maria. All this while creating a path for national nonprofits from the US and predatory developers to parachute into Puerto Rico and the Gulf South in search of economic opportunities and shine. The threats to our existence come from so many places, and now we can add COVID to all of this. Climate change is an unconventional threat that demands unconventional thinking and approaches. It challenges us to rethink our relationships with each other and conduct an internal audit of our institutions to assess if they're up to the task of dismantling the systems born of the extraction of our land and our labor, the extraction of Black, Indigenous, and people of color, the thing that got us here, or whether they will continue to be anchored in white supremacy. Climate change reminds us that conventional approaches and top-down white-led solutions that have contributed to the intersectional threats and challenges to our lives won't save us, that a radically different approach is required. And so I'm really happy to be here today to have this messy, uncomfortable conversation, because the thing that is messier and more uncomfortable is the impact of climate change in our communities, as we've already seen throughout the United States and are seeing as we speak. As we're watching communities burn, not have access to water, or be exposed to the emissions from the industrial sector, or even radioactive waste. Those are threats that we are experiencing right now. The Climate Change Health and Equity Survey tells us that the health sector has enormous economic and political clout to lead society away from fossil fuels, toxic chemicals, and industrial agriculture as health interventions. And across the board, nonprofits expect their work to increase on climate health and equity in the next several years on environmental justice, environmental health, racial justice, energy, air quality, food systems, drinking water, transportation, housing, and more. And I really appreciate the big undertaking that the Grant Makers in Health and several other funder affinity groups have taken on through the survey report and toolkit on climate change, health, and equity. The toolkit offers tons of resources to learn about the disproportionate impacts of climate change on frontline communities. And I encourage you all to check it out if you haven't. But that being said, I do want to point out one important oversight. The toolkit created by the health grant makers elevates the types of climate impacted communities without specifically lifting up frontline communities. And this is an example of why today's conversation is so important. There are communities that we call environmental justice communities that we refer to as sacrifice zones, who've dealt and are dealing with the direct health impacts and impacts to their bodies, their families, and their local environment inflicted by the industries causing climate change. Again, an internal audit based on the Hermes Principles for Democratic Organizing would have revealed the omission of frontline communities. And frontline communities are not only transforming their landscape, but they're changing policy, they're changing national priorities, despite the fact that they are desperately and unnecessarily and discriminatorily underfunded. They are literally leading the way on solutions. In my community in Sunset Park, for example, we have reduced net emissions, we've shut down power plants, we've doubled open space. The list is long of policy, infrastructure, and alternatives like our community-owned solar cooperative that we have operationalized to prevent toxic exposure while addressing the need for renewable energy and green jobs. The frontline leads with comprehensive, complex, multidimensional solutions. And despite all these victories, just so that you have an understanding of the threats to the work that we're doing on the ground and the transformation that we are engaged in, despite all these victories, just last week, we met with a university that has gotten funding to come into our community. And universities often and health facilities often see us as subjects, as the black and brown patina to their green agenda. This university got $700,000 from the National Institute of Health Sciences and wanted to meet with us to pick our brain because we're the experts, and offered us $1,000 for the next 2 years to provide them with access to our expertise on the ground on everything from infrastructure to community-based planning, to community-based research, to the data collection that we have been engaged in, for $1,000 for the next 2 years, while they got $700,000. In their application to the National Institute of Health Sciences, they actually said that they had consulted with frontline communities and were supported by that. This is the reality of what we are faced with. And so we believe that sharing power also means an equitable distribution of resources, and that decisions have to be made differently in terms of determining who comes into communities and how we complement each other, how we add value with each other, not supplant local leadership or compete with local leadership. That would require a real understanding and an incorporation of the Hermes Principles for Democratic Organizing, where we can talk about how we build just relationships, engage in transformation, and build the kind of communities that we need to survive extreme weather events that are on their way. Our people are victims of systems that extract, exploit, and oppress. And extraction isn't just extraction from the soil, isn't just extraction from our labor, but it's also extraction of our brain trust and the work that we have been holding for so long with so little. And we experience the daily impacts of this kind of racism every single day. So it's important that everyone understand that frontline climate solutions are health solutions, and that we need to focus on transforming systems, not treating symptoms. What are we up against right now? Our communities are dealing with extreme policing, with ICE raids, with the loss of employment, underemployment, housing, all of those things, the criminalization of our communities, all while also dealing with climate change. Climate solutions forcing we're also dealing with organizations and national initiatives that force false solutions that create environmental justice problems, carbon reduction at the expense of co-pollutants. So we have to do both, save the planet, and one does, you know, when we're talking about carbon and we're talking about climate justice, we're talking about saving the planet, and the other saves the developing lungs of our children. And one can't happen at the expense of the other. And so when we talk about co-pollutants and we're talking about the environmental justice issues that our communities have historically had to hold on to, we're reminded that PM 2.5 is another kind of gun. It's another act of violence on our communities. And that frontline communities located really within noxious, pollutive industries, such as oil refineries, fracking wells, coal mines, radioactive waste, power plants, pipelines, petrochemical and other manufacturing uses, rails, ports, and other major transportation corridors, landfills, incinerators. My God, the list is so long, and our communities are surrounded. The disproportionate risks of health hazards include and aren't even limited to spills, explosions, and exposure to toxic gases and chemicals. We know that our communities, if you look at Houston, surrounded by petrochemical industries, or you look at Port Arthur, Texas, where people actually have dioxin in their bloodstream, you know that our people have been exposed to this for generations. And then, in addition to adverse health impacts that can be multi-generational and life-threatening, there's other kinds of health impacts like burning eyes, nausea, nosebleeds, and the conditions that chronic exposure over time creates on our community, affecting even our ability to learn, impaired cognitive abilities, all the things that those of you that are deeply immersed in the health sector know are affecting our communities. And to talk about these things in silos and not understand that this is all happening at a multi-dimensional level in our communities, and that it's not just happening now, that it is part of the legacy of how our communities have been treated, is to miss how deep and how serious the threat to our survival is. You know, you need to think of us generationally, one generation after the other, having to deal with racial violence, having to deal with poverty, having to deal with lack of access to healthcare, having to deal with the tension and the stress that comes from that, the mental health issues that come from that. It is quite unbelievable sometimes to believe that we are still here, that we are still fighting, that we are literally transforming our landscape, and that we are leading with solutions despite it all. So these are the things that are happening in our communities and that have been happening. You know, when you think about Puerto Rico, you think about a tiny little island with 23 Superfunds hit with a Cat 5 hurricane and the dispersion of all of that toxicity in the air, in the buildings, in the soil, and in the water. That's what climate change is bringing to frontline communities, and frontline communities are leading with solutions. And we know, for example, that race is the #1 indicator for the placement of these toxic facilities in the United States. And I say that because often people will say low income, Black, Indigenous, people of color. The truth is that if you're Black, chances are that regardless of income, you're living next to environmental burdens, that race is the #1 indicator. Frontline communities suffer from chronic exposure to air pollution from oil refineries and all of these things, incinerators, chemical and petrochemical industries, urban island heat, island effect, food apartheid, exposure to lead paint, and many other contaminants and conditions, in addition to the aforementioned health impacts related to toxic exposure. We also have higher rates of asthma, diabetes, obesity, and heart disease. These are the things that have shown up in our communities. These are the things that made us particularly susceptible to COVID. And most of us were personally affected by COVID. And we didn't really need a study from Harvard to tell us that it was going to be our communities that were going to be impacted the worst as a result of COVID. We knew that the underlying health conditions and the history of toxic exposure, the lack of access to good health care, and that we were the ones that are going to be impacted. And then take into account everything else, the instability when it comes to economics and the susceptibility to other kinds of isms. We knew that our communities would be the most impacted. So we know, and we can, I think, agree that climate change exacerbates all the isms, right? And so what does this mean for grant makers? Well, this is really an opportunity to reflect and recalibrate. Your recommendations and funding say much about whether core values are centered on racial justice and equity. And this is what we know on frontline communities and funding. The Stanford Social Innovation Review stated that 95% of grant dollars go to white-led organizations, with 80% to male executive directors. Support of women of color-led work is less than 1% of foundation giving. And reports released in the spring of 2020 show that incredible barriers to funding that leaders of color continue to face. A recent study by the New School looking at 12 national environmental grant makers found that of the roughly $1 billion that they granted, only 1.3% of funding goes to justice-focused organizations. And according to the Climate Funders Justice Pledge, organized by Donors of Color Network, top philanthropies are giving a tiny fraction, just 1.3% of their US climate dollars, to Black, Indigenous, and people of color-led environmental justice groups who are doing the most to fight climate change. And I encourage you to really also check out the Donors of Color Network. This campaign calls on funders to commit at least 30% of their climate funding to Black, Indigenous, people of color-led power building groups. So foundations play a critical role. They have a critical role to play in this critical decade to move the money to the grassroots who are leading at the intersection of racial justice and climate change. And make no mistake, These are health solutions that we are leading. We came to this work because we were being personally impacted. I can tell you that my dad died of an asthma attack when he was 50 years old. That all of my family that passed as a result of COVID all was born and raised in environmental justice communities, right in the midst of brownfields and the emissions from highways and power plants and waste transfer stations. We all had the same underlying health conditions, and we were all exposed to that, whether it was in Puerto Rico, the South Bronx, or Brooklyn. So what does that mean where we are right now? What is that transformational change that we have to engage in right now? If our priority really is racial justice and equity, then what do our programs look like? What does leadership look like? How is funding decided? Who is getting that funding? Who's making decisions for us? Are our leaders being chosen for us? Or is there a real investment in putting resources into the front line and amplifying some of the transformational things that we have been doing and replicating those things and creating shared learning? Is it an opportunity for us to start thinking about how do we stop competing with each other, and how do we start complementing the work that we're doing so that it adds value and we use resources in a way that is strategic? How does racial justice, what does that look like in core values of the institutions that have the power to make it possible for us to engage in transformation? You have a role in taking climate action, and we're inviting you to go deeper on your political analysis around health inequities, disparities, and disproportionate impacts in Black, Indigenous, and people of color communities in proximity to the very industries that are causing climate change. We need you to connect the dots, because the root causes of the climate crisis, environmental racism, and compromised health, and the impacts of climate change are ensuring that we are losing lives. And this is not seen as an act of racial violence, and it is an act of racial violence. We need systemic change and not Band-Aids. Those closest to the problems hold the greatest solutions. And frontline communities, those impacted most by climate change, who live with environmental and climate injustice levied by extractive industries in and adjacent to their communities, resulting in chronic impacts to human and environmental health, the descendants of 500 years of colonialism and enslavement. Those are the communities that wield distinct wisdom, vision, and power to fight the bad, change the rules, and build the new. And we hope that you join us in this struggle, because this is one of those that we have never experienced in the past. We are seeing funding. We are seeing that there are those that are funding and investing in contradictions. And what I mean by that is that one cannot fund institutions that are pushing false solutions and solutions that really continue to honor the extractive economy, and also say that they are grounded in racial justice and equity. That requires an internal audit of our institutions. It really requires looking at not just how much funding goes to the front line, how much funding goes to those that are part of the leadership of these institutions, but who sits on the board of trustees, who's making the decisions, and accountability and transparency to ensure that institutions that have been conventional in their thinking and their approach, that have good intentions, are engaging in the transformation that climate change demands. Climate change is demanding another approach. And so, we can't become passive recipients of the good intentions of others. This is one of those crises where we have to lead, that we have to be leaderful, we have to be intergenerational, and we have to work in a way that really honors the size of the crisis. I have not had a lot of familiarity with health grant makers. And so this is my first step into having a conversation with you. But it is my hope that you engage in building community, not just with us, but with other funders who are trying to envision a different kind of future and are trying to make sure that the institutions that they lead and that they are supporting honor the size of the crisis. when you think about our demographics, there has to be a closer look on how those impacts affect different folks. And even the categories that are used in defining us are categories that don't tell our story. So for example, the term Hispanic is this all-inclusive term that includes anybody who has a Spanish ancestry or a Spanish last name. It really erases Blackness and Indigenousness for people who come from the Caribbean or the Americas, right? And so there are vast differences between Puerto Ricans, Dominicans, Mexicans, Cubans. Those differences are just as important as the differences between the Germans, the French, and the Italians, right? But we are all lumped into these categories that don't tell the story of how what our health impact is. The same is true with Asians. You've got all of these different ethnicities, all these different languages, all of this beautiful difference packed into one demographic profile that doesn't tell the story. And so you have the ability to start really challenging that and dig deeper, because people are not all impacted the same way. Look at the Gulf South and look at the people that are most impacted. If you look at the Gulf South and you see what happens with Hurricane Katrina, you know what happened to people, historical Black communities in the Gulf South. And you know that they were not only uprooted and displaced, but that now there is an investment in infrastructure and environmental amenities to benefit the privileged who have moved in to take over the land that once belonged to people who were the descendants of enslavement. Those are the contradictions that we are funding, and that is the close look that this moment requires if we are committed to creating a path to a different kind of future where we are going to be able to sustain life and we're going to thrive. And that really means unpacking how all of these isms exist in our institutions and in our own personal culture of practice. It is a commitment to transformation that we all have to make, and it is really what climate change is demanding of us. And so I invite you to be part of that conversation. And thank you for the opportunity for sharing my thoughts with you today. And I look forward to hearing from you. And anything from, I just want to say in closing that it's always amazing to us how folks often think that there are other folks who know more about how to engage in frontline solutions than we do. I want to remind you that we are not only involved in creating co-governance, we are creating financing mechanisms for just transitions. We are operationalizing infrastructure. We are passing legislation. We are engaged in community-based planning and community-based research and data collection, in creating a body of literature and information. We are changing systems. We are cleaning up and decolonizing soil. We are involved in agroecology. We are building leadership. In my organization alone, we've sent 4 young people to Antarctica and 3 to the South Pole, and have held 8 climate justice youth summits and send young people to the COP. We are literally changing everything with a scintilla of the resources that are invested in communities and leadership that doesn't look like us. And so can you imagine what we would be able to do if we were funded in a way that is equitable and that honors not only the legacy of extraction and abuse to our ancestors and to our communities, and to the threat that we are faced with today. That is a future that I hope that you support, that you embrace, and that you show exists, that there is the commitment of racial justice, and that shows up in the culture of practice of all of the organizations that are present here today. So gracias, Ashe, and I look forward to hearing from you. Thank you.
Elizabeth, thank you so much. That was so powerful and so necessary, and we are eager to get the conversation started. I thank you for inviting Health Philanthropy to join frontline communities in this struggle for climate justice with an eye toward transformation. Our questions have started coming in, so let me give you the first one. What can funders do to support authentic youth engagement?
I love that question. Uprose is an intergenerational organization. We believe that leadership and learning happens across the table and across generations. The idea of youth led for us feels extractive, competitive, pitting one generation against the other. It feels like an Anglo-American construct. But for Black and Indigenous communities, leadership has always been intergenerational, and the environmental justice and climate justice movement has always had young people integrated into leadership. In our organization, young people sit on our board of directors, on staff. One of our board members started when he was 14 and got a double master's from Cornell. And so young people of color have led movements from Black Lives Matter to the Young Lords, to the Black Panthers, to the American Indian movement, to the fight in South Africa against apartheid, the civil rights movement. But they have not been funded in the way that when you have a white youth-led organization, totally different. When you have a white youth-led organization, all of a sudden millions and millions of dollars drop to support that leadership. And that contributes to that racial divide, because literally the sacrifice of young people of color is erased. Even in this conversation about the role of young people in the climate movement has been one that has erased the role and the leadership of young people of color. So funders who want to support that should support intergenerational relationships and making sure that racial justice and equity is centered, and that we are not, that the next generation is not marginalized and doesn't have to take on the same challenges that our generation had to when we were in our teens and in our 20s. Because we're seeing a replication of that happening right now, and that is really unfortunate.
Mm-hmm. Thank you. Thank you. All right, second question. How could philanthropy help organizations like yours leverage the new influx of federal funds from the American Rescue Plan or the potential infrastructure bill?
Well, thank you. There needs to be support for increasing the capacity of frontline organizations and small organizations that have to deal with the bureaucracy of accessing federal dollars. And there also needs to be pressure on the administration to make sure that all of these agencies, including those agencies that don't have a history of working directly with us, because there are some that do, right? So you've got the Department of Energy, and you've got EPA with a history of working with our organizations. But if we're going to address Justice 40, or if we're going to address bringing funding to frontline organizations, there needs to be a training and a development of leadership within those organizations about how you engage, meaningfully engage with frontline communities, and how you move the funding to them directly without needing interveners or middle institutions that get a piece of that funding so that it goes directly to those organizations. And that requires training on both sides, to those federal agencies and also to frontline organizations that need the capacity built so that they know how to access and process those resources.
Mm-hmm, mm-hmm. So you touched on this a little bit, so let's dig into it a little bit more. With the new administration's stated focus on environmental justice and climate change, what are some of the key opportunities or potential pitfalls, in your opinion?
Well, there are a lot of opportunities. You've got an administration that has brought on a number of people that are aligned with the front line of the climate crisis. I think that some of the pitfalls is that while the administration has put together the Justice 40 initiative, and they got that model from the work that we were doing in New York State with the Community Leadership and Community and Climate Protection Act, is that the focus has been on benefits instead of investments. And we're hoping that the focus is on investments for our communities. And we've got a number of guardrails for that. And then the other part of that is that while there is a move towards investing in frontline communities and moving the funding for infrastructure so that we can address the issues of health, of infrastructure, of climate jobs, of seriously all of the things that our communities have needed for a long time and became even more evident during COVID, there's also an investment in false solutions and in supporting corporations in practices that really harm frontline communities. And so it feels like a zero gain if you're taking with one hand and you're giving with one hand and you're taking away with the other. So there is a need for consistency and accountability, and really monitoring those dollars and making sure that that funding is actually going to address the crisis that we're faced with. And so we are so excited over the fact that there is a Democratic administration, and that they're speaking in the language that we understand, and speaking to the values that we hold dear to us, that I think people are a little reluctant to be critical and to demand that they move as quickly and as aggressively to address the legacy of environmental harm that we have been enduring for so many generations. And so I think that that's a responsibility that we all have, that we need to engage in critique and lead with solutions. The truth is that we're not just talking about these are the problems, these are the gaps, these are the deficiencies. As a movement, we have collectively been meeting to shape the Thrive Act, the Green New Deal, and all the legislation that is coming out of Congress and out of the administration today. All of that has our fingerprints all over that. So it's not as if we haven't thought through what it means in terms of how we can literally transform the landscape in different kinds of communities. And the other thing that is important to think about is that it can't be cookie cutter, that the solutions are different everywhere in the United States, that what coastal, densely urban communities need is not the same thing as what happens where in a community that's engaged in mountaintop removal, or a community that is on a reservation, when we're talking about the rights of indigenous peoples, right? Or the Gulf South. The solutions are different everywhere. And I don't want to also neglect Puerto Rico and Guam and the US Virgin Islands, because I think sometimes no one thinks about the fact that solutions for the island territories need to also, need to be lifted, and that there needs to be an investment in those places as well.
Mm-hmm. Thank you. Fantastic, fantastic. So you gave some really stark, illustrative examples of partnerships that do not work with frontline communities, where frontline communities are not valued for their expertise. And I wonder if you could give some examples of some really impactful efforts in frontline communities, partnerships that are working, activities that are working, movements that are working.
Yeah, I mean, thank you for that question, because I think that when we're in a space like this, we want to flag some of the deeply and well-funded threats to that really block the possibility for engaging in transformation. From my organization, we have an amazing partnership with Pratt Institute and with different agencies that is funded by the Kresge Foundation. It is a true collaboration where there is shared expertise and community building, where we're not just thought of as the group that goes out and does outreach, but we are the ones that are framing it. Our community is the one that is setting priorities, and we are all working and bringing all of those resources together to engage in a transformation of the industrial waterfront. What does an eco hub look like on the industrial waterfront? How do we take a traditional industrial waterfront that has been responsible for a lot of the health disparities in our community and engage in what we call the green reindustrialization, where we are talking about climate adaptation, mitigation, food sovereignty, and strengthening social cohesion, and bringing in green jobs like the offshore wind initiative that is now coming to South Brooklyn as a result of a legacy of our work. So there are partnerships that are working not just in New York, but all over the country, and are really models of how you do it right. I know that through the Climate Justice Alliance and our members, we've got about 78 members all over the country, that there are partnerships in Oakland, there's partnerships in the Midwest and in Texas, and these are working. So I think it's important to really sort of gather those and share them as examples of what is possible and what the impact is. Because while folks think that we're small, and I think success is sometimes determined by how big the budget is instead of how big the impact is. And if you look at our institutions, the impact is pretty substantial. And so, you know, you look at a community like ours, and we're talking about just the neighborhood alone, or the corridor is 500,000 people. And so if you look at it regionally and what it would mean to bring offshore wind and engage in climate adaptation and mitigation and resilience, we're talking, you can multiply that a few times. And so, and these are all replicable initiatives, and we need to be able to share these with other communities that are similarly situated so that they can hit the ground running. So yeah, Osula, this is definitely, there are definitely initiatives that that really are anchored in racial justice and equity, and where the partnership is one of respect, where we work with each other in a way that is transformative.
Fantastic, thank you. So another question from our audience: how do you think about healthy housing and green spaces in low-income, underinvested communities?
Well, there are different kinds of spaces, right? And so it could be NYCHA public housing, or it could be Section 8 housing in New York. It could be privately owned homes. Every block is different, and social solutions have to be different. So the reason that I share that with you is that in New York City, or at least in my community, we organize people block by block to come up with solutions that green up the neighborhood. It could be that a row of houses decide that they're going to paint their rooftops white. It could be that they connect their backyards so that they could create water harvesting, or engage in building a bioswale or an anaerobic digester. It really depends on place. And the other problem with that is that what we've learned is that a lot of the environmental amenities and a lot of the successes that we've had have been used to promote our displacement. It's almost like the message to our community is that unless we live in the midst of environmental burdens that harm our children and our elders, that we can't afford to live here. And it's been a turnoff to people in our communities. Oh, we plant these trees, you know, the value of the home is going to go up and we're going to be pushed out. So these things have to become part of all the work that we're doing. And so those solutions are vast, but they're also based on place, whether it's community-owned solar, like the community-owned solar cooperative that we have in our community, or it's looking at, you know, we're looking at what 4 things. We're looking at air quality, water, energy, and food. And we know that COVID showed us what the challenges are. We were able to organize around food because there was a supply chain still there. But climate change threatens to stop that supply chain. And so how do we use place as a way of making sure that our people are able to take care of themselves and take care of their basic needs? And then really understanding financing and understanding supply chains and making sure that those supply chains are carbon neutral, and procurement policies that make it possible for us to live within our carbon footprint. So much of the world that we navigate our way through was created before climate change was a threat. So the work is enormous, but I think it starts with place. And I think that looks different in a lot of different places. You know, weather looks different in different places and the threats are different. You know, I was talking about the fact that Puerto Rico had 23 Superfunds, and in Indian country here in the United States, we've got, you know, indigenous people living like downwind from radioactive plants. Well, what does that mean in terms of an extreme weather event? And who's engaged in the science and the engineering to make sure that our communities are protected from that? This is an area that is so vast, but building alignment and centering on racial justice and equity is the only thing that's going to make it possible for us not only to be able to survive these recurrent extreme weather events, but to be able to thrive. So yeah, it's very local. And so even collecting that information and sharing what people in different parts of the country are doing is really something that grant makers can learn from.
It's fantastic. Another question from our audience. How can funders reach more women of color-led nonprofits to encourage more diverse applicants for their grants wherever they are?
Well, our organization is a women of color, a Black, Indigenous women of color-led organization. There are, I had mentioned some of the funders, like the Donors Network, Solutions Project, Climate Justice Alliance, Grassroots Global Justice Alliance, Grassroots International. These are all institutions that we work with closely because we are deeply engaged in base building and organizing, in popular education, and engaging our communities meaningfully. And there is a long list of organizations that that they work with, that we work with, that are women of color led. And so really it's about making sure that you reach out and that you make the process easy and accessible, that you trust that we are going to deliver on resources. It's amazing how so much money is invested in big green organizations and with little outcome compared to the size of the outcome with small grants that are given to our organizations. So it really is also assessing, is this reporting process cumbersome? Is this application cumbersome? When we have to stop the work that we're doing to take on an application that is hard to navigate through for $25,000, we ask ourselves whether it's worth it. And so we need to be nimble and we need to be able to be impactful. And so there are foundations that have developed a process where it makes it easier for us to report and for us to access the resources, everything from, the New York Women's Foundation to Solutions. These are foundations that have found a different way of making sure that they are bringing in women of color and that they're making the process one that makes it easier to support the work, the hard work that we're doing on the ground and the work that we're doing on policy as well.
That's fantastic. So as we wind down, I've got a big final question for you, but I wanted to let you know that one of our audience members has said, what aren't you addressing in your work? This is so impressive. Thank you for sharing how you've made it work for your organization. So I wanted to make sure you heard that out loud. My big question is for health funders who are not currently working on climate change, but maybe in the more sort of traditional health areas, what would you say to them, to the executives and staff and trustees of those foundations, to really encourage them to move forward in this space?
There isn't a single thing that we are working on that isn't going to be shaped, informed, and impacted by climate change. So if you're working on, if we even move away from some of the upper respiratory and some of the health consequences of environmental racism and talk about other kinds of things, whether people have disabilities, whether it's MS, whether it's autism, whatever it is, it's going to be shaped and affected by climate change. Think for a second of what happens to a child who has a disability. Maybe they can't communicate, maybe they're visually impaired, maybe they can't move, and there is an extreme weather event. What happens to that child, whether they're in school, whether they're at a program, what happens to their parents, what happens to our elders, what happens with social service organizations or organizations that are dealing with the traditional, conventional issues that impact all of our people. All of it is going to be affected by climate change. Think about what happens as a result of Hurricane Katrina and Andrew to all of those vulnerable communities. So there's no getting away from having to deal with the impact of climate change on the work that you are funding. There's just no getting away from that. Whatever it is, it's going to be exacerbated by climate change if it hasn't already. If you're working with the elderly, we are going to have extreme heat, prolonged extreme heat. And at the same time, they're going to be people living in jurisdictions where they won't have access to air conditioning or cooling centers, or where there's infrastructure to support the impacts of climate change. So it is not something that we can be siloed about. It is literally the bucket within which all the isms and all of the vulnerabilities live. And so, so that's what I would say to those funders, that if you are not thinking about how climate change is going to impact the work that is close to your heart, then you will not be ready when there is, when something happens. And, you know, in Brooklyn, where I'm at, in Lenape territory, we've had several tornadoes in Brooklyn. I say that because, you know, it's not Kansas, it's Brooklyn. And it's happened so often that people are already normalizing that. And I'm thinking about how, if a tornado of size lands, it's going to hit something. There aren't wide open spaces. Well, what does that mean for the institutions that are on the ground and the people who serve our communities? They may not necessarily be organizations or institutions that are dealing with issues of climate. And so the issue of even resiliency or a recovery then becomes sort of a red, what do you call those institutions that come into our communities to Red Cross, a Red Cross solution. And we have, our response is a just recovery. It's how do you invest in communities so that if, God forbid, there is an extreme weather event that has a big impact throughout the entire area, people will be able to take care of each other and survive. How do we strengthen? How do we use our resources to strengthen and centralize social cohesion in our communities? That is going to be important for every single foundation, because that is literally how we survive, strengthening social cohesion.
Woo! Well, Elizabeth, thank you so much. You have challenged us, you have inspired us. I wish we were all in a room together so that you could hear the thunderous applause, so that you could see the standing ovation, and so I could give you a hug of thanks. Thank you so much for being with us today. You knocked it out of the park, and I think you really inspired health philanthropy to look at these issues in new ways, to think about weaving together solutions in the way you've discussed. I don't think anybody's going to give money to an academic institution in the same way that they did before again, without asking some key questions. I thank you. I thank you for bringing to us the voices of the frontline communities that you work with and for. We appreciate you. Many thanks.
Thank you so much.
So now, folks, we are going to move into our breakout sessions. They start promptly at 2 p.m. Eastern. We will see you there soon. Many thanks. Bye-bye.